My name's Ted McDonald. I'm an economics professor in the Department of Political Science here at University of New Brunswick in Fredericton. I'm the inaugural director of the New Brunswick Institute for Research in Data and Training, which is our provincial research data center. I serve on the board of the Canadian Research Data Center Network, and I'm on the executive of Health Data Research Network Canada. The NB-IRDT begins with Andy Scott. He was a member of Parliament representing Fredericton, and he recognized early on that government doesn't have much of an evidence base for make decisions. People talked about the Tim Hortons conversation being the basis for important policy decisions. Departments are siloed, they have separate budgets, they don't share data. So the idea was, could we develop a data center where we can get data from everywhere and we can connect it and we can look at policy evaluation from the perspective of the person. I'm an economist, I'm a labor and health economist, and I've been at UNB since 2001. And for the first 10 years, I did data work. And I would look at pages of data sets and I would program and I would generate analysis and put it into journals. And I also, at that time, I worked with my now brother-in-law, who's a cancer surgeon. And I had a meeting with him and he said, let's just meet in my office. And we went through his cancer clinic. And everybody there is either a family member of someone with cancer or a patient waiting for treatment. And I realized that every data point that I see is a person with cancer. It made it real. It gave me that perspective that the data are on individuals and that we've got all these data sets in isolation, but they're on the same people. That data are collected by a department and they're kept in some system and the systems don't talk to each other. So you've got, if your kids are in school, there's a bunch of data that's being collected on them and it's in with the Department of Education. If your kid needs to go to the hospital because they've fallen out of the tree and broken their arm, it's in another system. So it's easy for government to answer questions like, what's the bed vacancy in the St. John Hospital? But every data point we have is a person interacting with a system, a health system, an education system, a justice system, whatever that is. And when you make policy that is kind of silo-based, it doesn't consider the fact that whatever's happening in this particular moment can have longer-term implications. An investment in early childhood education or an investment in making it easier for parents to go back to school is not just going to affect the education system, it's going to affect the kids once they get into, if they choose to go to university or community college, and they get into the workforce, it's going to affect their health, it's going to affect the parents' health, wellness, their retirement plans, their affordability, everything is connected. And in 2014, we got our first data set. It was hospital records. And there was much rejoicing. And in 2015, the premier at the time, Brian Gallant, was up here and we launched the Institute. And so we had a few staff and one data set and we said, okay, now we expect the floodgates of data to open. And then a few years later, we had 3 data sets. And the challenge was that there was a determination that unless every piece of legislation that covered a particular data set, it specifically enabled us to have access for research, you couldn't do it. And so the Act Respecting Research in 2017 inserted a research clause in about 25 different pieces of legislation, and it said, you now have the legal authority to provide prepared versions of personal information to a research data center, and we were the only one for research purposes. And that then was the reassurance that it's okay, legally this is allowed. And then data started to come in. And from then things have just taken off. So we've gone from 1 to 2 to 4, and now we have almost 150 person level linkable data sets. Report cards, health records, cancer screening, cancer registry, post-secondary education, long-term care, nursing home care. It's just an enormous amount of data. And the reason that we're doing this, the reason that we continue to operate is because it has to benefit the provincial government, it has to benefit the residents. Our work with post-secondary education, training and labor, one of the things that we do a few reports for them every year. When we started working with PEDAL, they said, we have actually no way to know if the immigrants that we work so hard to recruit to the province are staying here. We've done a lot of work looking at what is it about certain kinds of immigrants that makes them more likely to stay here. We've identified that, for example, if you're from the Philippines, you're more likely to stay. It matters if you have family connections here. It matters if you've already gone to school here. Time in New Brunswick matters. So that when these arguments come up in the legislature, if you're talking about policy, you say, here's the evidence, it works. So it's not that that people in government or others were unaware of the importance of outcome evaluation. It's just never been possible. So one of the things the province has embarked on is expanded scope of practice for pharmacists. So pharmacists can do more, provide more primary care and to charge Medicare for it. So this is in a pilot in 6 pharmacies in New Brunswick. We're working with the Department of Health and with the Pharmacy Association to do the evaluation of it. Is this actually improving? Is it reducing costs and improving healthcare by giving people more ways to connect with primary care providers? Ultimately, can you say that we change government policy? We can't, because this is just one input into the complicated process of government policy making. But at least we can say confidently that we are giving credible, honest, and reliable evidence so that it can be used in decision making.